9:42. Now we're getting a lesson in scar prevention and solutions. Board-certified plastic and cosmetic surgeon Dr. Greg Wiener is here with us this morning. Great to see you again.
Good to see you too, Ellie.
The key is preventing the scar to begin with.
Right. Well, most of the common sense things that you do for most wounds actually work. So keeping the wound clean, a little soap and water, an antibiotic ointment, a clean dressing, those kinds of things actually work.
And once a scab forms over the scar,
Right.
you say you soak it.
Well, you know, actually the best thing is to not let a scab form. It's been shown that actually a clean, moist wound actually heals better and faster than a wound that has a scab. Now, if a scab happens to form, then soaking it's not a bad idea. But the main thing is keep it clean and basically use a little bit of antibiotic ointment on
And
most
never
wounds.
pick at your scab.
Never ever pick at your scabs. Bad idea.
But it's so much fun sometimes.
Exactly. You want to get that thing off there,
Yeah.
but don't do it.
Once you do get the scar,
Right.
are there things you can do to reverse the effects?
Absolutely, absolutely. I mean, you know, you can early on in the wound healing, you can actually do things that may prevent the scar from looking bad in the future. Sun protection, using a good sunblock on a scar. Don't let ultraviolet rays beat up that new skin that's forming there. Scar massage, and actually using a silicone gel pad on the wound will actually help keep the scar flat and keep it soft. Those are great things to do early on.
What is a scar massage?
Scar massage is literally just rubbing the scar. You can actually influence how a scar heals by mechanical forces on the scar. So massaging a scar actually will help it from becoming raised in the future.
Wow, and you could just massage it on your own.
Exactly. 3 weeks,
Wow.
3-4 weeks after the scar after the wound is healed, you can start doing these things to protect the wound and help it from
Right.
from
While I'm doing
getting
that,
worse.
we have some before and after pictures that we want to show folks, and this is of a laser treatment that
Correct.
you did on some folks.
Yeah, if you have a scar and you don't like it, and you've done all the things that I tell you to do, and it's still you don't like it, there are things that you can do surgically or with lasers to help it. This is a case where there's some bad acne scarring, and we use a laser called profractional in my practice, which punches thousands of tiny little holes with a laser microbeam
Ouch.
through that. Yeah, well, it's really painless actually. It looks like it might be, but it's not. And actually you get improvement in this deep pitted acne scarring and even in the pigmentation with this laser.
Wow, and in terms of treatments, how many do you need?
Typically with this laser, anywhere from 3 to 5 treatments.
Wow, and then there's downtime involved too because
Correct.
you're puncturing holes
Correct.
into the skin.
Yeah, you're going to be a little bruised and a little bit red and possibly a little bit of bleeding for a couple of days.
And for extreme scarring,
Correct.
sometimes you do grafting, but not often.
Right. For most extreme scarring, we do things like actually removing the scar tissue surgically and reclosing it, moving tissue around surgically, and that's always a last option.
Okay, some great ideas. So just moisturize that scar or the wound to begin with. or keep
Antibiotic
it
ointment,
moist.
keep it clean, and again a good dressing. And
Okay.
if there's any question about a wound or how big it is, obviously see a healthcare professional, see your emergency room doctor. Wounds can be closed 12 hours after the fact and still look great and do fine.
Some great tips. I never knew you could massage your wound.
It's a
and
good thing to do.
prevent
Very
a
good
scar.
thing.
Wow.
Absolutely.
All right, Dr. Greg Wiener, great to see you.
Thanks, Ellie.
For more information, log on to NBCChicago.com and search Scar Solutions.